My name is Victor Marwin. I'm an orthopedic surgeon at Bluegrass Orthopaedics. I'm fellowship trained in hand and upper extremity surgery. And really, I take care of all conditions from the shoulder to the fingertip. Really, anything that you can think of that patients have wrong with them, from shoulder arthritis all the way down to finger fractures. So I take care of trauma, arthritis, tendonitis, nerve compression problems, any upper extremity problem that patients may have. I grew up in Buffalo, New York. I went to med school in Albany, New York. I was in the military for a number of years. When I was active duty, I was at Camp Lejeune with the Marine Corps. I was an orthopedic surgeon there. I ultimately decided to leave the military and start a civilian career. After I left the military, I did a year of hand and upper extremity fellowship, a subspecialty training for all conditions from the shoulder down to the fingertip, and find myself relocated to Lexington, Kentucky, which I've loved every minute of it thus far. I like to treat each one of my patients as though they're a member of my family, the way that I would want them treated when they go to the doctor. I like to hear about their personal stories, to share my own stories with similar experiences, whether it's a vacation that we're talking about or a hunting or a fishing trip. Ultimately, I think it enriches the experience. I hope that my patients feel welcomed, and I hope that they feel as though they have a physician that's listening to them. I treat each patient as an individual. I'm interested in their individual story, and I'm interested in their individual goals. But everybody has slightly different concerns, and I take that into consideration when I see patients, and I really try and tailor a plan that's unique to them, that gets them back to doing what they want to do on a timeline that's realistic and helpful to them. Carpal tunnel syndrome is typically treated non-operatively with wrist splinting and activity modification. And it doesn't really get rid of all of their symptoms. They're still unhappy, they still have numbness and tingling, it's still disruptive to their life. And then we need to start thinking about more aggressive options like surgery. Surgical options for the treatment of carpal tunnel, essentially it's carpal tunnel release. And in order to relieve pressure on the nerve, you have to release that ligament. So surgery is cutting that ligament and creating more space or more volume in the carpal tunnel. And traditionally that was done through an open procedures. There are newer treatment techniques, minimally invasive carpal tunnel release, such as endoscopy and ultrasound guided carpal tunnel release, that can release the carpal tunnel pressure and relieve carpal tunnel syndrome through more minimally invasive techniques. And what that allows patients to do is to return to activities faster. So it also allows for other different surgical techniques, such as local only anesthesia, surgery without a tourniquet, and really doesn't even require the need for post-operative pain medication. I think a lot of patients continue to suffer with carpal tunnel syndrome for a myriad of different reasons. They may have had a friend or a family member that had an open carpal tunnel procedure. Another reason is that they may just be a little nervous about the procedure. They may not want to have to take narcotics, and they continue to suffer with it. And over time, it can be very disruptive to their life. I've performed carpal tunnel surgery a lot of different ways that it can be performed. I've performed mini-open techniques, minimally invasive techniques, endoscopic carpal tunnel releases, and I do ultrasound-guided carpal tunnel release. So most of what I do currently is minimally invasive carpal tunnel releases. I check in with most of my patients about 48 hours after surgery when the bandage comes off. They have minimal to no pain. They're back to daily activities right away, and certainly a lot faster than if they had a more invasive open procedure. I don't really give patients many activity restrictions. I tell them that they'll have a little bit of soreness in the palm that should fade. So when I ask patients about the soreness, they typically minimize it, and they say that they don't really notice it, or that it pales in comparison to their carpal tunnel pain. So really it depends on the patient. The heaviest of the manual laborers will typically take a few days off and then ease back into work activities. But I'm constantly amazed by what these people are able to do and how quickly they're able to do it and how happy they are when they come back and see me.